It's my immense pleasure to stand in front of you and share my experiences. I am Dr. Chiranjiv Chhabra, dermatologist, and I've been practicing since 1997. I run a chain of clinics by the name of Allied Wellness, where we specialize in aesthetic dermatology and wellness in the field of medicine. So today I am going to be talking about regenerative modalities in hair loss and thinning. Now hair is very close to our hearts because hair is very precious, and all of us, even if we are not bothered about that wrinkle on our face, we are definitely bothered about the hair that we use from our head. So what is regenerative medicine? It is using the power of our own body, of our own cells, to restore the physiology to normal or to enhance it. And in aesthetics, we have been using it since a very long period of time, and maybe at a time when we didn't even realize we were using it. And at the moment of interest would be stem cells, exosomes, growth factors, and we at dermatology are using it for hair fall, thinning, and also for improving skin conditions. So as we all know, the source can be autologous or allogenic, and in skin and hair conditions, the conditions that we treat with regenerative treatments in hair could be just simple hair loss or thinning, alopecia areata, and regenerative alopecia, female pattern hair fall, discoid lupus erythematosus, basically all the scarring alopecias, and infections like folliculitis decalvans resulting in hair fall, and of course the telogen effluvium. And in skin conditions, we are treating skin quality, open pores, scars, burns, fine lines, post-inflammatory hyperpigmentation, eczema, psoriasis, post-traumatic lesions, and there is so much research that is going on in our field in treating other skin conditions. So the common causes of hair fall can be androgenetic, hormonal changes like pregnancy, childbirth, nutritional deficiencies, stress, hairstyling and hair treatments, chemical damage to the hair, and there are a lot of medical conditions which also contribute to hair fall, like autoimmune disorders, hypothyroidism, DNA, lichen planopilaris, lichen sclerosis, and so many of them. Now, important is to understand, now there's a lot of medications like beta blockers, antidepressants, which are very commonly used these days, especially after COVID, anticonvulsants, chemotherapeutic drugs, blood thinners, and a lot of fertility stimulating drugs. So how do we identify female pattern baldness? It is the crown that suffers, which means women have flattening of hair from the top, and we put it into categories depending on the Ludwig scale. There is progressive loss of scalp hair in the center. Then in men, we categorize it into stages by the Hamilton-Norwood scale, goes from 1 to 7. And anybody who has even mild loss of hair in the vertex is already in grade 3. And grade 3 can be treated, we can even treat up till grade 6. Okay? Now it won't be a complete treatment, but definitely we can give you results anything between 30% to 80%. Now this slide is important. What are the regenerative treatments which I am using for hair loss? Are energy-based devices. There is a laser which we do a super long pulse Indian laser, which works on hair growth, and it is regenerative. Low-level laser therapies. Don't use LED devices. Okay, these treatments we have been using since years, which means a dermatologist or an aesthetic physician is using for say 20 years, and did not know at that point of time that these were regenerative. We just thought we were chromophore and the chromophore was responding. Then the actual regenerative injectables like PRP, GFC, QR678, which are biomimetic peptides, exosomes, autologous conditioned plasma, which is actually a platelet-rich plasma with a lot of growth factors. Then there's autologous micrografting technology, biomimetic peptides, which are tripeptides, tetrapeptides, pentapeptides, and lately we're using PDRN, which is derived from the sperms of the salmon. Okay. Then there are other mechanical techniques like microneedling And also now we are using threads, which are video threads, which we place in the scan, and all of them are regenerative, not just the one in the center. So this is the earlier VR laser, super long pulse, which we use in our clinic. Now what is this doing? It works on the hair follicles, stimulates the stem cells, causes perivascularization around the hair follicles, brings the growth factors to the site where growth is required, improves the fullness and the quality, and practically if I share all the regenerative technologies, work on similar principles. Okay, now I am just missing this video because it will become too long. If someone is interested, I can always show them later. This is how we use the laser in treating the hair fall. Now again, platelet-rich plasma. What happens is that the platelets get activated, they release, and the alpha granules are released from the platelets, and they in turn release growth factors like PDF, which is platelet-derived growth factor, vascular endothelial growth factor, epidermal growth factor, TGF-beta, and these growth factors do exactly what a regenerative process requires. So this is, I'll come back to this. This is another video if we have time at the end. Then there is growth factor concentrate, which is actually a solution which has no platelets. It just has concentrated growth factors because the platelets are broken and removed from the solution. And why we prefer this is because it's more standardized than PRP alone, and the growth factor concentration is much higher. So this is how the GFC tube looks. And again, as I mentioned, it's more standardized, more concentrated growth factors. Then we are also doing something called AUTOLOGOUS conditioned plasma. Now this produces a solution which is actually PRF, which has growth factors, platelets, but it is rich in fibrinogen and fibronectin, which are plasma proteins. And this, the benefit of this is that it forms a scaffold because of the fibrinogen converting into the fibrin. It forms a scaffold, and the growth factors get sort of caught in the scaffold, and they are slowly released over 7 to 10 days. So it's a prolonged release of growth factors over a period of time. This is more concentrated growth factors, and the beauty is that because of lack of, we're not putting any anticoagulants, the inflammation, the pain is less, and the post healing is faster. So this is how this platelet-rich fibrin scaffold looks like, and this is prepared in a double tube. Now, important things which we'll probably be using are the QR678. I mentioned trade names because then you people will understand what we are doing in aesthetic medicine. It will be easier for you to catch on. This has a lot of biomimetic peptides, and the function of these peptides is again to stimulate the hair follicle, vascularization, collagen elastin strengthening around the hair follicles, and reducing inflammation, and thereby it helps in hair loss, which is not only hormonally induced but also due to inflammatory processes. Okay, now this is what I am using in my practice called Regenerative Activa, which is autologous micrografting technology, where we use sponge grafting from the area of the scalp, which is posterior to the pinna, and we put it into a processor called this Regenerative Activa cone. And what it does is it slices the tissue and takes out the progenitor cells into a solution, and this solution is re-injected back into the area that we want to inject it in. So let me see if this does. Okay, so I'm not going to this video. Now I would like to show you the exosomes. Dr. Ashu is going to take it after me, and these are nano-sized particles which are released from the outside the cell, and they work like messengers, and they have little software. They go to the target and induce the work they have to do. So let me show you some pictures. This is PRP post 8 sessions. We normally give PRP at a gap of 3 weeks. This is a female with female pattern baldness. Then this is a man with post 10 sessions of PRP. You can imagine how happy he must be with this kind of hair. Again, this is female pattern hair thinning. This is one session of the PRF, which is platelet Platelet-Rich Plasma. This is 2R678 biomimetic peptides with combination with exosomes, just 2 sessions. This is AUTOLOGOUS micrografting of progenitor cells, only 1 session. Now this is exosome. I told the patient nothing will work on you. You are in grade 6, OA to 7. But yes, these are 3 sessions. And patient wanted to try this before going in for anything else. Exosomes, 4 sessions. After 2 sessions and after 4 sessions. This is alopecia areata, where we give a steroid injection and top it up with exosomes. PRP and exosomes in combination, just 2 sessions. I have performed very fresh patients that have been treating over the last 6 months. Because here we can combine all the new modalities. There again with exosomes. So this is hair transplant followed by exosomes to improve the results of the hair transplant. So I conclude that hair is not easy to treat, but we can treat it by combining various modalities. And as you see, I have combined lasers, microneedling, as well as regenerative solutions injected into the scalp, along with nutritional support, along with supplements, topical medical applications. So what is, all of them are complementary to each other. It's not just that one thing is working. Thank you very much for a patient hearing. This is our clinic, Alive Wellness Clinics, and we also run an academy, Alive Institute of Aesthetics, where we teach physicians and their support staff how to do all modalities in the aesthetic line, and of course regenerative medicine also. Thank you very much.
Thank you so much.